All right, we're here today with Pat, and Pat's been a patient in our office for about 6 months now. And when she came in initially, she was having a lot of pain in her feet. She's diabetic, and she was experiencing a lot of diabetic neuropathy. So in the time that you've spent here at the office with us, can you tell those that are watching what your experience has been?
When I first started coming back in February, I could barely walk. I was not sleeping because the pain was so bad at night. I had to stop working and stay off my feet all the time. But since then, with the help of Dr. Lawrence, I have been on a special diet, gotten my blood sugars down 2.5 points. My blood pressures are much more normal than they've ever been. I've lost some weight. My neuropathy is still there, but it is probably at least 75% better. I am able to walk and do most of the things that I like to do. Still have to stop and rest a lot, but we're still working on it, and I have all the confidence in the world that it will be completely taken care of.
Well, what we found too is that you do have some vascular, problems in that leg, and that are kind of precluding us from getting a full resolve. But I think we're going to go ahead and get that taken care of, and when that's done, I really feel that you're going to be close to 100% on that, if not 100%. So
I think so too, yes.
As far as your blood pressure goes, you've been on that medication, surprisingly enough, since you were in your 20s.
Yes, since I was 24, and I'm 65 now, so I've been on it a long time.
And the interesting thing was that even though you were on the medication, it still wasn't right.
No.
It still ran high. So can you talk a little bit about that?
Yes, like I said, I've been taking it since I was 24 when I was with my second pregnancy, and have never been able to come off of it, but still had high blood pressures every time I would check it, and now my blood pressure is the closest to normal it has been in these 41 years. And
great.
I don't have any problem. Don't have the headaches and the problems that I was having before with that.
Excellent. I know initially, blood sugar wise, you had a pretty high A1C.
I had a 10.9 A1C, and then the last one I had done was 8.4, so that's 2.5 points. And I'm working on getting it down closer to normal.
Yeah. The medication that you were taking initially was a lot higher than where you're at now as well.
Yes, I cut my medication from 50 units down to 5 units on my insulin. So
you're down to 90%.
Cut my other medications in half. So.
Excellent. And the numbers that you're seeing in the morning are much better than they were.
Yes.
I know initially when we looked at yours, it was, I think, 172 was your blood sugar fasting.
Yes.
And now you're seeing, it's been fluctuating. It's been a little bit higher lately, like in the 120s, but we were seeing it down around 100 for a while there. So there's still some things that we can do with that as well. Is there anything else that you'd like to add? Anything else you can think of?
No, just if anybody thinks that only medical doctors can help with problems like diabetes and high blood pressure and neuropathy, you need to really check with Dr. Lawrence and get on her program, because it does work.
Great. Thank you, Pat. Appreciate it.
You're welcome.